Good morning. It's my pleasure to be here and to present on behalf of the Public Agency of Canada opening remarks. Bonjour, c'est mon plaisir d'être parmi vous et de pouvoir offrir le message de bienvenue de la part de l'Agence de la santé publique du Canada. Over the years, the Government of Canada has maintained a strong commitment to addressing hepatitis C in Canada. Through the Hepatitis C Prevention, Support and Research Program, the Government of Canada has been able to support viral hepatitis research and surveillance, care, awareness, and prevention activities. The agency works closely with provincial and territorial partners to ensure that its ongoing effort to address the burden of viral hepatitis in Canada is evidence-based, timely, and responsive. The Government of Canada acknowledges the role played by community-based organizations such as yourselves in addressing hepatitis C, including the role played by the Canadian Society for International Health. The agency funds the Canadian Society for International Health to mobilize Canadian and international expertise in order to facilitate dialogue regarding the best practices related to hepatitis C prevention, care, and awareness. According to the agency's most recent surveillance data, close to about 1% of Canadians have been exposed to hepatitis C. 2/3 of these individuals have developed a chronic hepatitis C infection. When we look at Canadians who are vulnerable and exposed to hepatitis, we find that foreign-born individuals are disproportionately affected. The agency estimates approximately about 80,000 to 159,000 foreign-born individuals who have been exposed to hep C in the past. Other affected populations include those who use injection drugs, those in prisons, Aboriginal peoples, and homeless people. While new treatment provides a new hope for those infected with the hep C virus, prevention remains a priority area of focus for the agency. Events like this one present an opportunity to share information with each other and about what works and what doesn't work. Furthermore, they provide an opportunity to dig deeper and to also work together to identify factors that result in successful interventions so they can be applied with other communities and in other settings. The systematic application of what we've learned from evaluate programs, research, and surveillance, and the application to subsequent cycles of program development and delivery is called by some as program science approach. The agency is working towards fostering a program science approach to hepatitis C and other sexually transmitted and bloodborne infections. Hopefully, over time, we expect that the information shared at gatherings such as this one will support the more systemic application of evidence to programs, resulting in more efficient and effective response to hepatitis. On April 1, 2017, the agency will replace its HIV and Hep C funding streams with the new HIV and Hep C Community Action Fund. So we are hopefully on track, Jeff. Work is underway to develop the new fund, which will take an integrated, holistic approach to HIV and hepatitis C, other sexually transmitted infections and bloodborne infections, and other co-infections such as tuberculosis, social determinants of health, and other aspects of health such as mental health and aging, and still retain a focus on HIV and Hep C. So these changes are intended to ensure that the design and delivery of the programs will continue to effectively address the agency's mandate on health promotion and disease prevention. So today's event will play an important role for those who are actively engaged in the prevention and control of hepatitis C in Canada, as it will allow them to identify the types of interventions that will achieve the best results. So I wish you a successful workshop and stimulating discussions about the opportunities that lie ahead to address hepatitis C diagnosis, prevention, and care and support needs of the immigrant populations. Je souhaite que cet atelier ouvrira l'occasion d'avoir des discussions stimulantes sur les différents enjeux liés à l'hépatite C, fait face les populations ethnoculturelles immigrantes. Merci. Thank you.